I am Dr. Jim Grew. In this video, I'm going to be showing you how to import a CCDA that's received through direct messaging. Direct messaging is built into every certified EHR, and it's one of the biggest efficiencies that you can bring to your office. Offices that use this technology tend to be able to add additional patients to their schedule because of the time savings that result. There's also an increase in accuracy of the information you have to use in treating your patient. In this case, we're going to be looking at a patient with the name Felix DuPont. All I'm going to do is show you that in this database, there is no patient with the last name DuPont. I'm going to go to the direct messaging system, which by regulation has to be password protected. In this particular application, direct messaging looks very similar to Outlook. So if you know how to use Outlook email, you can use this with basically little or no additional training. So our patient is right here. You can see that I've received direct messaging in this system from Crystal, from Epic, from Rev360. It doesn't matter which system generates a CCDA. They all get processed exactly the same thing, the same exact way, and they have a uniform format. So every EHR is creating the exact same document. So when it's received, every document's processed in exactly the same way. It allows you to communicate with any other office with a certified EHR. Here's our patient, Felix DuPont. This is the message that was received, and this is the attachment, the CCDA attachment. If I click on that attachment, I can now view that. I can go to the CCDA viewer. So just as a PDF or a Word document or anything else can be viewed, a CCDA can be humanly viewed. These are the sections that are included in it. You can see here there's a section on allergies, there's medications, there's a plan of treatment, there's a problem list. So I can go in and I can read all of this, but the value of it is this information can be consumed right into my workflow. So I'm going to close this, and now I'm going to go to Import CCDA. So you can see the system is now importing that document. It's extracting the individual pieces of information, and it's embedding it in my workflow, in my actual exam that I'm going to be conducting on the patient. You can see that the CCDA has been successfully imported. That means I can go back and find the patient in my patient database. And now you can see the patient's there. I'm just going to double click on the patient's name. The system has extracted the demographics from the CCDA, and it set up the complete patient automatically with nobody from my office having to do anything. If I go into the examination section, you can now see that the problem list is embedded in my problem list in the EHR. It's now a permanent part of that. You can see that the medications have been added to medication list. If there were lab orders, they've been added. You can see that the allergies down here are added. Whatever information is in the CCDA can be brought over and embedded into your workflow. Utilizing this feature that's already built into your certified EHR is one of the biggest efficiencies that you can bring to your office. It pretty much eliminates a patient having to fill out a clipboard or go online before their exam, entering information. The information obtained this way comes directly from the primary care physician treating the patient, so it tends to be more accurate. It also tends to be more inclusive. So when your problem list is brought in, if you're seeing a diabetic patient, for example, you know the specific diagnosis code that the rest of the care team is using to treat that patient. So in addition to efficiency which allows you to save time during your exam and potentially add additional patients to your schedule as a result of this. You also get more accurate information, and the whole exam experience tends to be less stressful on the patient, who does not have to go through that long history and feel like they may be forgetting part of it, because in reality they probably are, especially on a patient that has multiple disease conditions. So you get better data, it's a better experience for your patients, and it's more efficient for your office.